Hello, my name is Maria, and for my capstone project, I chose medication errors. Today we will be discussing risk factors and management. Medication errors can cost the country about $3.5 billion yearly. There's about 100,000 preventable medication errors in the United States annually. Medication errors do not only cost billions of dollars to the country, but also patients' lives. For example, in 2009, a young boy was prescribed fentanyl by his dentist. Fentanyl is a narcotic drug which is usually prescribed to patients with cancer. Also in the year 2010, a nurse in Seattle Children's Hospital gave an infant 10 times the original dose of calcium chloride, resulting in the patient's death. So what is a medication error? A medication error is a preventable event that may cause inappropriate medication use or patient harm. This leads to an adverse drug event. An adverse drug event is any adverse event that involves medication use. What are these common preventable medication errors? Wrong drug, wrong dose, wrong frequency or time that the drug is being administered, wrong route, wrong patient, and drug interactions. For example, here we have a picture of a nurse that is new in the field. She's about to administer potassium chloride but is not sure of the route. Instead of going to a co-worker or someone experienced, she just guesses and administers the wrong route. What are the risk factors that lead to these common medication errors? Some of those factors are fatigue, lack of sleep, stress, not being able to concentrate, or personal issues at work or at home. Also having incompetent staff or staff which lack training. Here we have another example of a very responsible nurse that has been in the field for quite some time now. But today, before he administers insulin to a patient, he receives a call from home. When he returns to administer the insulin, he walks into the wrong room and administers the insulin to the incorrect patient. Other factors that account for these medication errors are illegible handwriting on drug orders. Also, error in transcribing drug orders. For example, orders that are received by phone. Confusion of drugs which have similar names or similar vials and bottles. Other common errors are due to abbreviations. Some abbreviations may be mistaken. For example, QD, which is usually mistaken for QID if not written legible. How can these risk factors be reduced? They can be reduced by using a reference book or an online database. Also, having a pharmacist supervise shifts in hospitals to help our nurses calculate the dosage based on the patient's weight will help. Laboratories can also help by enhancing and changing labels on lookalike vials or vials that have similar names, that the medicines have similar names. Other strategies are limiting staff working hours. Most nurses now work 12-hour shifts. Those shifts can be reduced to 8 hours. Also, hospitals and facilities can provide newcomers with appropriate training and make sure they don't have incompetent staff. The use of electronic records and the use of e-prescription is also encouraged. For example, to avoid errors when there are illegible handwriting orders. And also, of course, creating a stress-free work environment without interruptions and distractions that can account for these errors. Thank you so much, and I hope you liked it.